Thank you very much, Mr. Chairman and committee members, for the privilege of appearing before your committee. SB 1283 addresses an important consumer problem that was brought to the attention of the Senate Select Committee on Autism that's chaired by Senator Steinberg. Specifically, this bill will expedite the resolution of appeals and grievances that are filed by consumers with the Department of Managed Health Care. SB 1283 simply clarifies the existing law so that consumers can work with the Department of Managed Health Care in completing the appeals application process so that these grievances are evaluated and resolved in an appropriate and timely manner. Senator Steinberg has requested his staff to work with the health plans to address their recent concerns to ensure that any consequences that are imposed by this bill are appropriate and fair. Testifying today in support of the measures are Beth Capell, who is the policy advocate for health access, and also Rick Rollins, parent of a young adult with autism and co-founder of the Mind Institute. Thank you very much.
Thank you. Witnesses in support. We'll take 2 witnesses, 3 minutes each.
Beth Capell on behalf of Health Access California. We recognize that this issue arose out of the concerns of persons who had family members with autism, but this issue is much broader. Making sure that we handle grievance and appeals processes properly is at the heart of making sure that HMOs and the Department of Managed Health Care actually respond to the needs of consumers. The delays that were underway with respect to autism were utterly unacceptable. We think this is an important bill to tighten up the existing law with respect to the handling of grievances and appeals. Thank you.
Mr. Chairman and members, Rick Rollins. I'm here representing some major components of the autism community, the Association of Regional Center Agencies that provides funding for these services, a consortium of ABA providers that provide direct services to children with autism, and a group called ACAO, the Alliance of California Autism Organizations, which is comprised of 52 individual autism groups here in California. We're very much and strongly in support of this measure. It's an important bill to help families navigate their way through this process, and urge your support. Thank you.
Thank you. Other witnesses in support?
Jim Lantry with the DIR Floor Time Coalition and California Parents for Choice of Treatment for autism treatment options. I can say that correctly. This bill goes far beyond autism, but with autism, treatment delayed is treatment denied. It is important to have the law clarified so that parents of children with autism can get the treatment when they need it. If you delay that, the opportunity is lost. It's important to move it as quickly as possible. We urge an aye vote.
Move the bill.
Amanda Levy, California Psychological Association. Our members work with children with autism spectrum disorders in support.
Thank you. Other witnesses in support? Witnesses in opposition, please come forward.
Charles Bakke with the California Association of Health Plans. We actually have a support unless amended position on this bill. We absolutely share the idea and concept of this bill, which is to improve the grievance process and try and bring it to a quick resolution. We're on the other end of this from the parents and the advocates, where we are subject to the long delays by the Department of Managed Health Care as well. The amendment we're asking for is in one very small section of the bill that right now, as the bill is currently written, assesses an automatic fine on health plans if we're not able to produce some information within 5 calendar days. There's some very legitimate reasons why at times we cannot meet that 5-day deadline. Like, for instance, a provider may not be able to get us a medical record in time. Under current law, we have a little bit of flexibility there for the director to give us a couple of days pass. The current version of the bill, however, would automatically penalize us. We've brought this up with the author and his staff. They've pledged to work with us on trying to find a compromise. They've given us some language. We'll respond back, and hopefully we can have this all worked out in the next few days. But at this time, we're currently opposed unless amended. Thank you.
Thank you. Other witnesses in opposition? Hearing none. Questions from committee members? Seeing none, we have a motion and a second. Would you like to close, please?
Thank you so much. The concerns raised by the health plans are very legitimate, and we look forward to working and resolving them. Thank you very much.
Thank you. This is a motion do pass and refer to appropriations. Secretary will call the roll.
Monning.
Aye.
Monning, aye. Fletcher. Amiano. Carter. Carter, aye. Conway. De La Torre. De Leon. De Leon, aye. Eng. Gaines. Hayashi. Hernandez.
Aye.
Hernandez, aye. Jones. Lowenthal. Nava. Nava, aye. Perez. Salas. Salas, aye. Smythe. Strickland. Strickland, no. Silva. Silva, no.
That has 6. It'll move to call. Thank you.
Thank you very much.
And now we'll move to item number 20, Senate Bill 1392. Senator Steinberg